You clicked this video because you're in pain and you're wondering, could shockwave therapy actually work for me? Well, in this video, I'm going to share 5 key signs that shockwave therapy might just be the answer you've been searching for, especially if you're tired of painkillers, rest, and being told to just live with it. Here's how this video is going to go. I'll take you through 5 specific signs that show you might be an ideal candidate for shockwave therapy. You'll also learn the why behind each one, so you're not just guessing. And at the end, I'm going to reveal the single biggest myth about shockwave therapy that holds most people back from giving it a try. Don't miss it. So, stick with me all the way through. You'll have a clear answer by the end. Before we get stuck in, if you're over 50 and want to stay pain-free, mobile and strong, hit that subscribe button now. Here on the 10X Physio channel, we share expert tips, exercises and treatment insights to help you feel younger, move better and live life on your terms. Hi, I'm Gavin Noble, founder of Gavin Noble Physiotherapy here in Lisburn and also the face of the 10X Physio channel. We help people aged 50 plus get out of pain and back to doing the things they love without relying on constant GP visits, medication, or invasive treatments. Let's talk about whether shockwave therapy could be your next step toward feeling better. If your pain has been hanging around for over 12 weeks, it's likely no longer an acute injury. It's become chronic, which means your body has essentially stopped trying to heal it. This is where shockwave therapy comes in. It delivers acoustic energy to restart that healing process. It's like flipping the switch back on and telling your body, this area needs fixing. Whether it's heel pain, shoulder issues, or elbow trouble. If it's been there for months and not improving, shockwave is worth considering. Have you tried rest, ice, stretches, massage, maybe even cortisone injections, and you're still in pain? You are not alone. Many people come to us frustrated thinking they've tried everything. But the truth is, some conditions like plantar fasciitis, Achilles tendinopathy, or tennis elbow need something more targeted. Shockwave therapy addresses the underlying tissue problem, not just the symptoms. If you've done all the right things and you're still limping, aching, or wincing, this therapy might just be what's missing from your recovery. Have you been dealing with one of these nagging issues? Drop a comment below and let me know what you've tried so far. Or if you're ready to speak to a real expert, get in touch with us here at Gavin Noble Physiotherapy in Lisburn. We do offer free discovery sessions where we would love to be able to help you work out if shockwave therapy is the right fit for you. And remember, at the end of this video, I'll share the biggest myth about shockwave therapy that stops people from getting amazing results. It's something I hear all the time, and it's just not true. Now, do you wake up with sharp heel pain when your foot hits the floor? Or feel stabbing elbow pain when lifting a kettle? These are classic signs of tendinopathy, tendonitis, or fascia irritation, and they often respond brilliantly to shockwave therapy. The reason is shockwave helps stimulate tissue regeneration, especially in areas where blood flow is limited. That's why it's so effective in places like the plantar fascia or the Achilles tendon. If you've got startup pain or activity-related aches, this is a big green flag that shockwave might help. Let's get specific. Here are the conditions we treat all the time with shockwave therapy here at Gavin Noble Physiotherapy. Plantar fasciitis, Achilles tendinopathy, tennis and golfer's elbow, calcific shoulder tendinopathy, gluteal tendinopathy, which is hip pain. If you've already been given one of those diagnoses by a physio, GP or consultant, Shockwave therapy is well researched and clinically supported for these issues. It's non-invasive, done in the clinic, and often works where other options fall short. If you're like most of our clients, you're trying to avoid going under the knife or getting more injections that just mask the pain without fixing the cause, Shockwave therapy is natural, non-invasive, and gets to the root of the problem. There's no downtime, no stitches, no medications. You walk in, have your session, and walk right back out, on the road to healing. If surgery or injections feel like a last resort, Shockwave therapy could be a powerful alternative. Here's the biggest myth I hear. I tried Shockwave once and it didn't help, so it mustn't work for me. But here's the thing, Shockwave therapy isn't a one and done treatment. It usually takes a course of 4 to 6 sessions, depending on your condition. And the healing continues long after your last session because it activates your body's own repair systems. So if you tried it once and gave up, you may have stopped too soon. If you're serious about getting out of pain and want to know what to expect during a Shockwave therapy session, then click on the video right here, should be on the screen right now. And if you're in Lisburn or nearby or just want to talk to a specialist therapist, head to our website or give us a call here at Gavin Noble Physiotherapy. So I'm Gavin from Gavin Noble Physiotherapy, helping you stay strong, stay mobile, and stay out of the doctor's office. I'll see you in the next video.